Hello, everyone. Heather Holmes here with KTVU Fox 2 News in the San Francisco Bay Area. And joining me once again is Dr. Rashid Chotani. He is IEM Medical Director and helping with vaccinations all across the country. Doctor, always a pleasure to see you.
It's always a pleasure to see you, Heather, and to talk about this very important part of history and issues that we are dealing with in the United States right now.
Yeah, and let's start off with this, a lot of concern about a potential fourth surge. What are the current numbers?
So we have approximately 31 million people that have been infected by the disease. Unfortunately, we have over 560,000 Americans who have lost their lives, which is really, really very sad. Yesterday, we had over 73,000 people who were tested positive for COVID, which is a 14% increase. We anticipated or expected an increase after the spring break and after Easter, but that is a pretty substantial increase that we are seeing. Overall, what we are seeing is that the deaths have declined, which is very good. We had close to 2,500 deaths or 2,500 deaths reported yesterday, which is certainly a decrease of about 31% over the past 14 days. But what is concerning is that we had 43,000 people hospitalized yesterday, which is a 5% increase over the past 14 days. Now, that is the big concern that people like myself and healthcare providers and public health workers have, is that we are going into the fourth surge right now. And even with the vaccination efforts, moving very rapidly, we are still concerned. And since the vaccination efforts started December 14th, about 170 million people or doses have been administered, meaning that about 64.4 million people in the US have been fully vaccinated. But that's a large number, but still think about it, it's only 19.4% of the total US population. For herd immunity, we need to get about 70 to 80% of the population to be vaccinated, fully vaccinated.
Yeah, so we've got a long way to go, but President Biden feeling optimistic. In fact, Dr. Chotani setting out this ambitious timeline of when a majority of Americans can, in fact, get their vaccines. Let's say that all goes according to plan. Do you see the U.S. sort of roaring back to normal on July 4th?
So I honestly feel that, I hope that happens. And I wish that is something that is going to happen, because we really are tired. Everybody's exhausted. But July 4th seems to be a pretty steep hill to climb to get 70 to 80% of the population vaccinated. At the current rate that we are doing it, although the Biden administration has come up with a three-pronged policy, which is a community health center policy, pharmacies, and community vaccine centers. Now, community health centers are going to be, there are quite a few right now that are operational, but in the next few weeks and months, we are expecting that there are going to be about 950 of them that are going to be operational. That is going to help the minority communities, low-income communities in a big way. Then pharmacies are going to be, the administration will double the number of vaccines that are being provided to them, making vaccines available to about 20,000 pharmacies at convenient locations to all Americans, which is very good. And then the big effort is the community vaccination centers. And community vaccination centers are something that FEMA, the federal government, the emergency management segment of the government of each state is working on. So these are federal agencies and state agencies working together to put together these mass vaccination sites that can vaccinate 3,000 to 6,000 or maybe 10,000 people every single day. Now, these are sites that are going up, and they will be, and it will continue to go up. FEMA has a very strong plan in terms of vaccinating the population of the U.S., and they will be pushing that plan out, actually operationalizing that plan in the next few weeks. So I'm hopeful and very optimistic that a lot of Americans who need the vaccine will be vaccinated. The critical thing is going to be, does everybody want to be vaccinated, number one? Are there going to be people who do not want to be vaccinated? And if the supply comes very smoothly, For example, when last week we had an issue with one of the vaccines, the Johnson vaccine or the Janssen vaccine, where a lot of vaccine had to be, there were some manufacturing errors, and we were not able to get all the vaccines. They were not used essentially. So if none of that happens, then obviously, we will be in much better shape by July 4th. But I am not sure if we'll be able to vaccinate 70 to 80% of the population by that time. It will require a little bit a longer phase to get to that level. And then we also have to consider whether the variants that are circulating right now are going to cause any other effects, and will we need a booster dose or something else to make sure that we are covering our population for the variants.
Yeah, I mean, the president and other healthcare providers have said that we are right now in a race against those variants. And especially one is very troublesome. It's one that we actually found here in California recently in the Bay Area, which is the one that originated in India.
Yes, absolutely. This particular variant that we found in California is quite an interesting variation in what we've seen before. Now, we had seen the Brazilian the variant, we had seen the South African variant, we had seen the California variant. Now, this particular variant that originated in India takes some components from the Brazilian and South African variant similarities, and some from the California. And we know that the California variant or the mutation was more transmissible, right? So if that's the case, we still don't know, in all honesty, if this double-stranded mutant strain that has come out from India and now is in the U.S., and it's probably not just one case. We probably have a lot more cases, and it's spreading pretty quickly in the U.S. Whether it's going to be whether the vaccine is going to be effective against it or not, or is it going to be more infectious or transmissible? Probably so, because it has that California mutation in it. But I'm pretty optimistic, because so far, the vaccine that we are administering, the 3 vaccines that we have, the initial tests have shown that they are effective against the variants, perhaps not as much as the wild strain was, the original one, but they're still effective. So I'm optimistic. Studies have to demonstrate that, and studies are being done, which will demonstrate whether this new Indian strain is going to be if it's going to cause devastation. But at the same time, one of the things that we have to consider, that we are now unfortunately looking at data that clearly demonstrates that even with vaccination going on, because of the relaxation and people being tired and fatigued by staying indoors, want to go out, it's summer, the numbers are going up again. So we are going to have a fourth surge. My only hope is that we control it to a point that it does not get to where we don't want it to be as we go into the fall season.
Yes, that's what we're all hoping for. All right. Dr. Rashid Chotani, always a pleasure. Thank you so much.
It's always a pleasure to be with you, Heather. And let's make sure that even if you're vaccinated, we continue the masking, the social distancing, and the hand hygiene. I know that businesses have to be open, and they should be open, but let's make sure that we do everything in a very intelligent way so that we do not transmit the disease to anyone. Thank you.
An important reminder. Thanks so much. Dr. Rashid Chotani, thank you.